The heart's normal rhythm, which we call normal sinus rhythm, is controlled in the right upper chamber called the right atrium. A site called the sinus node fires at a very regular interval, typically about 60 beats per minute at rest, and it can accelerate when patients are exercising. That firing will then activate the upper chambers, the atria, to beat, and then those impulses go down to the lower chamber, the ventricles, to allow those to beat. All of this coordinates the beating of the heart so that it can function very efficiently. In atrial fibrillation, that efficient beating is disrupted. Rather than beating at 60 times a minute, the sinus node is no longer functional, and the atria are beating very rapidly and irregularly, upwards of 350 beats per minute. Those impulses then bombard the lower chambers, which beat very rapidly and irregularly. It's that rapid and irregular beating that causes the symptoms and the problems related to atrial fibrillation.
Well, atrial fibrillation is a technical medical term that refers to a specific type of electrical short circuit that occurs in the top part of the heart. What that means to the patient may be very different depending on the individual. Most commonly, it's the sensation of a rapid palpitating or pounding or skipping, jumping in their chest, a quivering sensation. Because when atrial fibrillation occurs, instead of the heart beating in a nice, smooth, regular manner, it's beating very erratically. It's sort of like crossing the spark plugs on your car and expecting it to run properly. It obviously doesn't. Now, for some patients, they may not feel that. What they may experience is shortness of breath, fatigue, lightheadedness, trouble doing their daily activities because the heart's not pumping effectively and efficiently. Some patients, because the heart's beating very rapidly, can experience discomfort or chest pain associated with it.
There are three main reasons why we worry about atrial fibrillation and why we feel the need to treat it. The first and probably the most important is stroke. Atrial fibrillation is a stroke risk in patients, and their stroke risk is different depending on what other problems they have. So patients who have high blood pressure and diabetes or heart failure are at higher risk than people who have atrial fibrillation and no other medical problems. Fortunately, we have ways to treat that with medicines, and the medicines we choose depend on the level of risk. The second issue with atrial fibrillation is it can cause heart failure. And if people have very rapid and irregular heart rates with atrial fibrillation for extended periods of time, that can weaken the heart muscle. Now, fortunately, that can be reversible, but it's got to be recognized and treated. Lastly, it can cause symptoms. While some patients in atrial fibrillation have very few or no symptoms, many are significantly altered in how they perceive themselves and their lives and how much it impacts on what they do from day to day.